a minute. Hey Lee, how are ya?
Hi, Dan.
Hey, what's going on?
Nava.
Okay. Where did I put my earbuds?
Hi, Dan. I'm gonna assign you
Hey,
host
Kara.
so you can let participants in, okay?
Great. Can you hear me okay?
Yes.
Okay, awesome. Thank you, Kara.
Do you want me to start the recording or would you like to do
Sure.
that?
Yeah, no, start it up.
Okay.
We're just about
one
there.
second. Oh,
Great. Great. Thank you, Kara. I think we're all set.
all right. Have a good meeting.
Thank you. Thank you.
Thank you.
Hey, Rita, how are ya?
Good, I'm in sunny Florida.
I
I heard you have nice weather. So
Well, yeah, it's not bad today. Hey,
Yeah,
Lisa.
yeah.
Hey, Margaret.
I love this Zoom. We can all meet all the time.
Do we really want to meet all the time?
We can meet after, I mean, you know.
Hey, everyone.
Hey, Lisa. Hey, Sharon. How are
Hi.
ya?
How you doing?
Hi, okay.
This week I'm celebrating my sister day.
Okay, let me just shut that down here.
Celebrating 25th.
Okay. Mhm.
So do you think these meetings will ever be in person again, or is this the way that
I
it takes?
hope so. I hope it'll be in person again. I certainly hope so. You know, it's, I mean, the moratorium goes till January.
Mhm.
After that, you know, there would have to be like another, I guess, a
Yeah.
legislative order or legislative action or executive order.
Uh-huh. We'll see what happens. I think things are gonna get better.
I think so too. And now that children are able to get vaccinated, I think that's going to be a huge bonus to this.
You know what I find good, just to add something, is that, you know, you can be out of town and participate. The weather could be terrible outside, especially for older people, like when it snows and stuff like that. And transportation issues, where people have to run home and eat something fast and run to the meeting. This gives you a little leeway time. And I think it's very
Also, you
good.
can do back-to-back meetings and not miss anything because you don't have to travel.
Right, that's a big thing.
Yeah.
I've belonged to a number of things. Thank
There's
you.
a lot of positives, but you know, the human part of it is.
Well, that I know, you know.
That I agree with you, Sharon. I'd rather hands-on.
Either that or we can
Yeah.
get puppies. We'll get a puppy. I'm
Hmm.
only saying. But I know it's nice to be together and see you in person.
It's definitely much, yeah, I think much better in person. I'll give it just another minute. I'll see if Karen joins us. And we'll get a roll call going. Hi, Miriam, how are you? Jillian, how are you? Oh,
Good. How are you, Dan?
good. Okay, I've got an iPhone coming in. That is.
attorney is moving toward convening a special grand jury criminal investigation.
Okay, is Julie?
Am I missing something?
No, I was just giving it another minute, but we can get started right now. And we'll see. I think most of us are here anyway. Marvin's not and Karen's not, but hopefully they join us. So, okay, welcome everyone to the October meeting of the Aging
November
Committee.
meeting?
November.
November, oh
meeting.
goodness, I'm in the wrong month. I'm sorry.
But it was a review.
Yes, oh goodness, I'm sorry. Welcome to the November meeting of the Aging Committee. It's going by fast. So we'll start with a roll call of our committee members, just to make sure we have everybody here and that we have a quorum to meet. So we'll start up here. Karen is not here. Sylvia?
Oh, it's
Sylvia
Sylvia.
Alexander? No. Margaret Della? Margaret, we can just, I know you're here.
I'm here.
Okay. Well, Lisa Daub is present.
Here, yeah.
Marvin Goodman. Marvin, am I missing you anywhere? Okay, and Rita.
Hello, everybody. Good to see you.
Okay, so we have a 7-member committee. We have 4 members present, so we do have a quorum, and hopefully the other members will join us as we go. Let's see, do we have any representatives of any elected officials here? Okay, so I do want to note that we do have some representatives of our provider facilities. If you guys can just introduce yourself, just one at a time, and which provider you're with.
Hi, I'm Julie Dalton with RSS Riverdale Senior Services. Nice to see everybody.
Hi, Julie, nice to see you.
Miriam Rabner, MJHS Hospice and Palliative Care.
And I'm Sharon Asherman. I'm the director of the Older Adult Center, the Riverdale Y.
Well, welcome everyone. Thank you for coming to our meeting. We have a pretty short agenda today, and we're just gonna kind of get right into it. I asked Julie Dalton if she can just kind of give the public a little bit of information of what, and Sharon and Miriam, please, supplement as well after Julie, kind of gives us a little more information. What I wanted to know, and it was Julie's, idea, and thank you for it, just to let the public know what some of the providers are facing in terms of, vaccine mandates and requirements and COVID testing for any individuals that want to use a senior provider facility in our community board. Julie, if you can just kind of give us an overview.
Sure. I think, those of us in the provider community, there have been a number of executive orders about the COVID mandate. So currently, the latest one indicates that all staff, consultants, interns, volunteers, must be vaccinated. So that's the latest. But what is difficult for us as providers is that we are still not able to inquire or mandate that a client or a senior center member be vaccinated. It's protected health information. That's the guidance from the Department of Health. So while it seems counterintuitive, you could go to a restaurant or a museum and they'd ask you for your vaccination card. You can theoretically come to an older adult center and not be asked for proof. Now, we at RSS, we do temperature checks and screening, but one of the challenges for us is that, as you may know, we are now allowed to do on-site activities, but only at 25% capacity. But given that our clients are saying to us, well, I want to know who's at the lunch table with me and are they vaccinated? So many of them are staying away because, again, they don't understand this protocol. I've, spoken to our staff and said, whatever our personal opinions may be, as contractors who receive government funds, we must, go by that, the mayor's order. So that's kind of where we're at, and we're seeing our robust online programs are gangbusters. Our 25% capacity is only 28 people for lunch, 40 people at one time. And again, a lot of people are just saying to us, I'm not going to come back until I know that everybody's vaccinated. So that's a challenge. Understandable, but it's a challenge.
Yeah. Is the only reasoning right now is because of the release of healthcare information, or is that just because the, city and state haven't done anything further?
I believe that what DIFTA has told us is that it's protected health information, and that which I think some people disagree with, but some and that the Older Americans Act, which ultimately funds older adult centers, says you must be accessible to all. So that's what
Gotcha.
we've been told by DIFTA. I don't know if Sharon's gotten different information, but that's
Gotcha.
what we've been told. And until DOH or the mayor gives a different guidance, that's what we have to do.
Gotcha. We appreciate that. Sharon or Miriam, did you want to add anything on anything that you guys are seeing out there with regard to this?
Yeah, I have a few things to add.
Sure.
So my understanding was that the Vaccine Command Center doesn't want people to be denied services. So, because it's an older adult center supposed to be open to all, they don't want people to be turned away, somebody not to get a meal or somebody not to see a social worker because they're not vaccinated. But on the flip side of that, what's happening is the vaccinated people are purposely staying away because they don't want to come unless people are vaccinated. So I'm not sure what can be done about that, but I feel like my group would really like for us to have, to have vaccine mandates. The other issue that this is an issue specific to the Riverdale Y, because we have our senior center throughout the building with other activities going on. It's become increasingly difficult to run our programs. We previously used the theater, so we in the beginning when we reopened, we used the theater for our concerts, figuring that the capacity is 200 people and that we can easily have 40 people spread out. And now the Department of Health came in and said you can't have unvaccinated people in your theater. So the administration, and I understand they did this for all the JCs, other JCCs are doing this, also says, just to be safe, because the Department of Health can close us down, so older adults can't use the theater. We have this in our gym. All our exercise classes were through the building, but because you have to be vaccinated to go to and use our fitness center and any of those rooms, we can't use those rooms for our older adult center. And so we've been squashed into the second floor and had to really limit our programming and to the rooms on the second floor, which are not big enough. So, and of course, with 6 feet separation, they're not big enough to really run groups appropriately.
Yeah. Well,
I have a question. Actually to Margaret, sorry, because Margaret, I don't know if everyone knows, Margaret heads the Kingsbridge Heights Center, which doesn't have a senior center, but has community programming going on. I was just wondering if any of the rules also is having some quirky impact on your attendance for other programs, or?
We don't, same as Julie described, we can't mandate our participants to be vaccinated. All of our staff are vaccinated as of actually today. Everyone has to be fully vaccinated as of today. So it's the same thing. We are frontline facing staff or community facing staff. So we have had staffing challenges too. Not so much that people won't come in, but it's just very stressful. And so we have a lot of turnover going on right now. So, but I can certainly empathize with what everyone's saying.
gotcha. Are you, is KHCC getting involved in any of the vaccination for children or becoming a site, has been a site for any vaccinations throughout? Like,
We've
remember-
done pop-up vaccination buses and things like that. We also are, we sort of have a high touch recruitment through our KHCC Connect office, which is case management for anyone in the community. So anyone who's waiting in line at the food bank, or in our programs, Spanish and English speakers, we're trying to get people vaccinated in the general community.
Yeah, gotcha. Thanks, Margaret. Here's Karen. So look, from our committee, I think this is all useful information. I mean, the question is, you know, what does the city do at this point with regard to it? And I mean, I'm curious to know, are we losing more folks, like, meaning, are more people avoiding the centers than would come if they're not vaccinated?
Absolutely. Absolutely.
I
Yeah,
hear
Yeah.
this
they
from my
are.
neighbors. Yes, you must be.
And if they're connected, you know, via the technology, then they can participate in remote. But if they don't have that option, they're staying away from the center. Yeah.
Yeah. Lee, did you want to add something? Yeah.
Yes, as a member of both the Riverdale Senior Service and the Riverdale Y, I'm telling you, I've done both. I've attended one class and they had restrictions. There could only be 8 people in the class and we had to wear masks, and this was an exercise class. We're all seniors. It was very difficult to do exercises with a mask on. And even though we were 6 feet apart, and actually the person who was conducting it was also doing it at the Y, and she was told what you just said, Sharon, she couldn't do it in the gym, but during the warmer season, they could do it outdoors. But now that it's cold, she can't teach the class anymore at the Y. So she's down with us at the Riverdale Senior Services. But I have access, obviously, to Zoom. So the classes that are available through Zoom are great because we get like I just took a class this morning. There were 20 of us. This is a class that's normally given at the center. She couldn't do it in the center. And also, I also am annoyed that I would like to know the person sitting next to me on either side, in front of me and behind me, has been vaccinated. And I don't understand this HIPAA thing. DFTR is like, they need to talk to the people who run restaurants and gymnasiums. If they could ask, what privacy are they invading by asking this? Who at HIPAA, who at DFTR decided this? It must be, I'm sorry. I know people who work at DFTR and they are totally not on this planet. Sorry.
I think the commissioner and other staff defer to the Department of Health and Mental Hygiene. I mean, they do take their guidance from DOH-MH.
So I can blame
yes.
them too. Maybe Chomsky needs to do some talking. He has a mother and a grandmother.
One of the things older adults are asking is what we can do. And I've been telling people call 311 and complain, because at least I know that when you call 311, you get a certain number of complaints. The ones to DFTR all go to the same person who then calls you back and who then calls me and or Julie.
No,
and
stop calling.
This complaint, but it kind of goes around. But they are logged and and tracked in some way. But they, if we organize, they would be marching on down the streets. And I just don't know if I'm the person in my position to organize that, given the safety issues, and it's kind of murky. But if we prompted them, they would organize themselves.
Is there something, that perhaps this committee should do? Should we ask DFTR if they have hard numbers of people who, or any type of numbers of folks who, it's so hard, I guess, to count, like how many folks are staying away from facilities versus how many are saying that they wouldn't attend, or wouldn't be able to attend because they're not vaccinated. I mean, or we could ask the agency, if there's been a thinking or a rethinking of this.
Well, I think the agency could give you more on the ground stats. DFTR couldn't, because DFTR would just get, they even haven't given us, after all this time, clear guidance on reporting some of our units of service, but So, but they wouldn't get down to that granular level of
Mhm.
who's staying away. They would look at the participation on site, is it 25% capacity? And then your virtual programs, one of the other challenges and opportunities is we now have a lot of people attending our virtual programs.
Mhm.
And we've now updated our forms so we get their zip code when they register and they're free. But if they don't live in the 5 boroughs, we can't count them as a unit of service for DFTA.
Oh, wow.
So, which is, it's good and it's bad. It's okay, because that's a whole new cohort of people that we're engaging, and we can engage them in other ways. But obviously, if they don't live in the 5 boroughs, I can't count that as a participant at our older adult center. So
Yeah. Yeah. Gotcha. Okay. Okay. I mean, this is all incredibly useful information that we can kind of pass on. I could reach out to DOH and just see if there is any thinking about shifting this, and see if there's anything on the horizon or a timeline of the horizon, or if there's any other questions that you think we should ask either Department of Health or DFTA, please let me know, and we could forward it on.
yeah, and they could possibly, this is some of the other rumors that go around, they're waiting for the administration to change.
That makes
So,
sense.
Yeah.
Hello?
Yep.
Hello?
Long process.
Karen, you're live online.
Yes,
Sorry,
ma'am.
I'm on Zoom.
Where is Karen?
Mhm.
Okay. So, well, thank you so much for that. Okay, so definitely good to know, and it's definitely something that what I'll do is I'll just come up with a very short email, and ask the office to send it on to both DOH and DFTA, our reps there, and see if there's any more information on this mandate that we could pass on at next month's meeting.
Dan, I was just,
yeah.
sorry to interrupt.
Sure.
I was just wondering, I mean, I feel like sort of part of your question about have behaviors changed because of vaccines, or is it just sort of like the nature of the pandemic, or because people they got into a different routine than they had been doing prior to the pandemic? So I wonder if part of the letter should also be recommendations from RSS and the Y, Riverdale Y, and others on like other ways in which they think is justifiable programs or programmatic activities that they could be reimbursed for. I don't know if you all have changed the scope of your work so much so that it's not just like virtual versus in-person, activities, but I don't know. I guess I was just wondering because they're so rigid in what they reimburse and what they don't, sort of some of the examples that you gave, Julie. But I'm just wondering if that makes sense at all, if there are other opportunities that you're seeing that aren't reimbursable, or is it just that you're just waiting for people to get back into the groove of coming into in-person activities?
I think that would be useful to find out. And then in DOH-MH's favor, because we have a geriatric mental health initiative for that with them, and all of fiscal 21, and it's a value-based contract, so it's not a line item budget. So we would be paid at a higher rate for an individual counseling session in person, but all during the pandemic, they allowed us to do those by phone at the higher reimbursement rate.
Mm-hmm.
We haven't seen, at least I haven't seen quite the same flexibility from DFTA, because DFTA's contracts are more a line item budget, and there's certain lines that you can't move and can't touch. So for all of fiscal 21, we didn't serve meals. So all that food money stayed on the table. You couldn't move it to another line. So that's kind of a greater conversation about how can these contracts give us a little bit more flexibility as we plan our deliverables. Yeah.
You also should be aware that we just went through an RFP process, and we're in the process of, we received our awards and are in the process of negotiating with DFTA. I can't speak for the other agency, but we were not pleased with the award. And basically we were told to submit a budget and then request based on what the award was, and then request a negotiation. As opposed to submitting the budget and they don't even have the budget office at DFTA DIFTA doesn't even have access to a copy of the budget that we submitted in the RFP. So they basically wanted us to duplicate all the work, submit a budget based on what they want to award us, and then come to the table and negotiate and explain why we need more. And what programs we wrote in the RFP that are gonna be cut because they reduced the award.
Well, we're in a similar situation. We took a slightly different tack. Again, we were not at all pleased with the award. It was a provisional award subject to budgetary and programmatic negotiations. So we pushed for negotiations. And I just told them, my board is not authorizing me to sign this. So we did a counter proposal. And we have our negotiations scheduled this week, but we already, did a counter proposal, and that's what we're going to work off of. So we'll see. Fingers crossed. Yeah.
Are there any specific questions you'd like us to present to DIFTA, or any statements that you think this committee or the board should present to DIFTA with regard to that budget process?
Well, I think a couple things that might be useful. A lot of, the RFP was based on this 5-year community care plan that the mayor issued. And the first year has happened. DIFTA is talking a lot about there's extra money in the budget. They're opening up 25 new centers, which is great, in my opinion. This is my personal opinion, but they should not be doing that on the backs of the existing providers. And, I know this is confidential, but the award we were given is the exact same bottom line we've had for the last 10 years. And they asked for a lot of different, so I think some key points in the community care plan is they talk about investments, they talked about expanding services, reaching people where they are. So then to come back and say, well, here's your budget, it's what you've had for the last 10 years, that's, that
Right.
to me didn't make sense. So I think pushing the point that to invest in older adult centers, you do need to invest in the staff. That's the biggest cost, is the staffing. And you need qualified professional staff to run an older adult center with all the parameters that they're now asking for, including that you need to do both. You need to do on-site and virtual. So that's my 2 cents.
Okay.
And maybe that one piece on just the telehealth, if you will, maybe that could be used as an example, Dan, where, from telehealth, mental health services that we're providing, it's part of it is that we've just received a waiver from the state and the city, but we're hoping that it's going to be a long-term adoption of this new way of providing telehealth. And so the quality of the service isn't any less because it's virtual. And so for providers to be receiving less funding to have those same number of telehealth services, seems like irrational.
Yeah.
And, behaviors have changed. People don't want to travel across the Bronx just to get mental health services. That's what we're seeing too. People getting on buses or having to do like the share ride that older adults use, that sort of thing, like that's exhausting. So why is it that providers are being penalized for the behaviors changing in individuals? And it's actually a smarter way of getting the services that you need.
Yeah, especially since they're saving money on transpo, on the transportation costs. Yeah. Makes sense. Yep. Okay. Do we want to add did anyone else want to add anything else to this part of the conversation? Okay, so just moving on, I just have updates from providers, which, we've been getting quite a bit of already. But if there's anything else that you guys want to add about anything going on that you think the community should know about, the community board should know about, Sharon and Miriam?
So-
Yeah.
Oh, Sharon, go.
Okay, so I'm pleased to announce that the Riverdale Y was awarded a new contract from DIFTA. We
Congratulations.
will be taking over the Ampark Nork from the Bronx Jewish Community Council.
Oh, wow. Wow. That's big.
Yeah, it's very big. So so Bella and her remaining staff will be coming on to our staff.
Okay.
So many of you know Bela from these meetings. And so it'll be as smooth a transition as possible. We don't have a transition date yet, but I, myself and Deanne and Matt, the executive staff of the Y went over and met with everybody at the NOC and with the president and the housing management. And we're just waiting for a transition date from DIFTA.
Oh, wow. Wow. Well, congratulations. And yeah,
Thank you.
it's a big program. I mean, the Amalgamated is a substantial community.
Yeah,
Yeah.
no, we're very excited about it. And, you know, it's obviously it's really good for the Riverdale Y. It means that we're not just we really can say we're not just the community center, we're not just the gym, and we're not just Riverdale. And really, I feel like it really extends us as a social service agency, as opposed to what people seeing. I mean, a lot of the stuff we've been doing recently also has been really geared towards community service, and but this just extends that a little bit more and makes us makes us have a huge dent on really helping people in our neighborhood. So,
Yeah. Well, wow. Okay. Yeah, that's big news. Miriam, did you want to add?
I heard something today. I just want to bring it up. Maybe you can fill in with more information that the express buses have a new agenda on cutting back services, that the east side service might be eliminated altogether and the west side service very curtailed. Has anybody gotten any updated information on that? Because for seniors going to the city and even going to a museum with limited capacity or going for physician or hospital visitations, that's a huge loss.
Yeah.
And
I know that the Bronx bus network redesign is continuing, and I think there was just like an update to that. I'm not sure if it's part of that. I haven't read the redesign paperwork yet, but I'll certainly take a look and see if there's anything about the express buses. Obviously, it was a huge point of contention about 2 years ago when they first came out with their final proposed plan, which wasn't final, but was, and they supposedly said that they were going to drop any cuts to the express buses, but I haven't read the new plan yet. I do have to read it. If there is anything in there, we'll certainly update it. And, you know, to the extent that they do, I'm sure I shouldn't say I'm sure, but I would hope that our board takes a position on it. I would certainly raise it and ask our Traffic and Transportation Committee to take another look at it. You know, we're on the record for opposing any cuts to the express bus in our community. And again, I can speak to the traffic chair and see if she's gotten any word of it, but I haven't read anything new on the bus network yet, redesign. But I will check it. Thanks for raising that. You know, it really wasn't on my radar at all. Okay, anyone else? Okay, so, you know, some big news there. Minutes, I have to apologize. I thought I had sent the minutes out. I did not. I have them on my computer. So you guys are going to get the minutes from October. That's probably why October was on my mind. Very shortly. So we'll move on to outstanding business or new business. Is there any outstanding business or new business that folks would like to raise for this committee? Okay, on that note, yes, we are. I'm
Wait,
sorry, Lisa, go ahead.
Judith,
Judith, are you applauding that we're ending a little early?
No, I pressed the wrong button. I pressed the wrong button.
Did you want to say something, Judith?
I did.
Okay, go for it. Go ahead. Floor is yours.
I facilitate the current events committee at RSS. And what we found today is that for the infrastructure bill, New York State's going to get $27 billion. And one of the plans does have to do with express buses. And Dinowitz on his website, this is Jeffrey Dinowitz, on his website, has pointed out that some of the bus stops in Riverdale have been eliminated, or they're trying to eliminate them. So I think that's a very good issue to get involved with. that the money can be appropriated for increased express bus or local bus or increased bus stops. I think that really applies to the senior age group.
Gotcha. What, was that in a newsletter?
No, it was,
Oh.
Schumer was online talking about how what money is being allocated to New York State and
Okay.
all of the different ideas that are being considered.
Gotcha. And they said that some of our bus stops are going to be,
No, Dinowitz,
Jeff
Dinowitz
Dinowitz
said
said some
yeah,
of them
Dinowitz
would be
has-
eliminated.
that there was a
Newsletter.
bus stop in Riverdale that they're planning to eliminate.
Gotcha. Okay, so we could certainly look into that and see where that bus stop is. That's an easy one to find out then.
And then remember, we were talking about having the beeping traffic light by Marshallou with that blind person.
Yes,
lives.
which was in the traffic committee. And I could follow up with Kira again and see where she's at with DOT.
Right, because I don't want that issue
Um,
to die, you know.
Yeah, no, I remember that issue. Let me just see if I can pull
Right,
into
you were
here.
helpful with it, but it's got to move further. So
Yeah, let me
see what
just
you can do,
see.
especially if there's some
urgent
kind
need.
of funding.
Face email requesting accessible. Yeah, no, what I'll do is I'll send Kira a follow-up email with Deb, the new traffic chair, and see if
Okay.
they've gotten any more word from DOT. If you
Right.
haven't heard yet, the Bronx DOT commissioner will be leaving. I'm not sure if he's left already, but will be leaving shortly, is taking another position in state government. And I'm sure with the new administration, we will have a new commissioner, probably on not just the borough level, but probably the citywide level as well. And we'll see how that goes. But Rita, to answer your question, I will follow up with Kira
Okay,
and shoot an email to see if they got any more response on that.
right. Okay, thanks.
Okay. Any other issues or anything else folks like to cover? Well, on that note, everyone have a wonderful Monday. Enjoy your afternoon. And I will see you guys soon.
Thanks,
Thank
Dan.
you. Bye-bye,
Good night.
everybody.
Take care, everyone. Have a great day.
Bye.